And another health threat is looming for Jamaicans, this time dengue. The increased rainfall across sections of the island has created more breeding sites for the mosquitoes that carry the disease. The local and central government authorities are trying to respond. We have more in this report.
In July 2020, the authorities declared that the dengue fever outbreak had ended. But since then, the country enjoyed extensive rainfall. And now a virus that had taken the backseat to COVID-19 could make a swift comeback. This circular from the Ministry of Health reminded Jamaicans that the mosquito that carries dengue remains in Jamaica, and it is likely the rains could have created more breeding sites. Health Minister Dr. Christopher Tufton sought to alert Jamaicans of the danger in yesterday's COVID press briefing.
But I want to encourage Jamaicans to remember that dengue is still out there. The Aedes aegypti mosquito is still out there. And what we really don't want is a dengue outbreak with a COVID community transmission. That combination would be quite challenging for us. Certainly the hospital system and its response, it would be difficult. And so I urge Jamaicans to take note and protect your environment, get rid of breeding sites, be aware, and we will have an increased fogging schedule that will take in weekends across the communities, across the country, as part of our control measures for dengue.
The Ministry of Health has heightened its surveillance, launching search and destroy missions. But members of the Clarendon team are hamstrung.
Some of our vector control workers, though, we have had to shelve and stop them from fogging because they were fogging continuously to try to get the dengue outbreak under control. And now we have a situation where their cholinesterase levels are high, meaning that the insecticide that they have been using, they have been absorbing it into their system. And now their blood works are now abnormal. So we have had to rest some of our vector control workers for at least a month to try to get their blood tests back to normal. So you'll find that we have had to suspend fogging.
One councillor was not pleased about the developments.
And I'm a bit surprised that we allow the staff to be exposed to this chemical, knowing of a fact what could happen to them without first breaking the schedule to allow those a section of the team to rest. So we don't really have this prolonged break in the response to the treatment or fogging of the mosquitoes in respective areas.
Dr. Scarlett explained that temporary staff are in the field searching for and destroying mosquito breeding sites, but they are stretched thin in terms of staff.
You know, we have limited permanent staff. We have 9 permanent staff. So that has been the challenge, why it is that they have been overexposed. I know that our chief has long been lobbying to get at least duplicate like 18 or 20 permanent staff. I know that there were some resource challenges why we didn't get the permanent staff. So if we had more permanent staff, then you wouldn't really have to be utilizing the same staff over and over and over.
The work from the COVID-19 response and now dengue prevention will surely test the health workers.
Persons are weary. We have been working very hard from March, going up until 12, 1 o'clock, writing reports. So many of us are tired, including myself. But we have to still keep going.
Persons in the meantime are asked to collect and destroy old tires, cans and other containers that may catch water around the house, as they may serve as breeding sites for mosquitoes. Dwayne Anderson, TVJ News.